is Bella. I'm your nurse today. Can I have you state your name and date of birth? Alright. Today we're going to perform a urine sample that's from your catheter, and then we're also going to irrigate your catheter today. Alright. So first things first, I'm going to expose him and clamp his catheter as to have the urine start pooling. Once I have that capped, I can go ahead and cover him up and get my supplies ready. So I'm going to grab my needle, grab a sterile alcohol pad, get my urine specimen cup ready, and I'm going to go ahead and glove. Alright, I see you've started pooling. I'm going to go ahead and now take my sterile alcohol pad and I'm going to clean the port. Once I've done that, I can go ahead and take my needle. I'm going to stick it in the port. And I'm going to draw up the needed amount of urine needed for my specimen. Once I've done that, I can go ahead and unclamp the catheter and reattach it to the side of the leg, making sure my needle does not touch anything and become non-sterile. I'm going to pick up my sterile specimen cup on the side, and I'm going to make sure that none of my needle or syringe touches the outside of the specimen cup. I'm going to go ahead and discard my needle, grab my cap, place that, take the label, fill that out, and then make sure it gets to the lab on time, and then I would go and report. And since we're doing our irrigation right now, I'm going to go ahead and get rid of this set of gloves. I'm going to put an absorbent pad by our patient. I'm going to take my new set of gloves, open up my irrigation, pour that in there. Going to open up everything I need. I'm going to place my sterile basin on the pad, making sure not to contaminate it. I am then going to undo this from the leg. I'm going to then undo the irrigation tube from the catheter. Once I have that done, I'm going to place a sterile sleeve on the end of my irrigation tube and place it to where it will not get contaminated. That in there. I'm going to draw up my irrigation fluid. And now that I have the prescribed amount, I'm going to go ahead and place it on there. Once I have it all administered nice and slowly at a constant pressure, I'm going to undo that. And I'm going to let it all flow into the sterile basin until it's fully clear. Once it is fully clear, I can go ahead, unsleeve my irrigation tube, reattach it, attach it back to the leg, clean up my mess, and allow the patient to go on with their day. Did you feel any pain at all? All right. Have a good day.